Is it difficult to treat trauma patients via telehealth where you can't actually get a face-to-face with them?
Mhm. Yeah, that's definitely been a challenge. I think the COVID situation has added a lot of insults to what people already had their injuries. And I think, like I was mentioning before, the therapeutic connection and sense of trust in the relationship, whether it's with a medicating provider or a therapist, is such a big part of healing. And the telehealth sessions just don't have that same level of personal engagement, and that's one of the challenges of this virus, is that, as everyone's been talking about, it divides us from each other, from ourselves, from our supports, and in the same way it divides patients from their therapists and the people who are trying to help them. So it is an extra challenge, but but we're, it's important to reach out and try to stay engaged and help them through it.
Now, things like disassociation, I would think, with a lot of people in social isolation, is disassociation kind of a real concern because they can't even see a lot of their friends and family members?
hmm Yeah. Yeah, I think especially facing, I've been seeing a lot of fear, a lot of anxiety, a lot of it very justified, but also a lot of it extra challenging for my trauma patients. And it's not surprising at all. And in fact, you would expect it, that they would be using their sort of old trauma set patterns of managing stress and the situation, and dissociation is a part of that. And so if present circumstances become overwhelming, the fear is too great, of course they're going to space out with themselves. They're going to kind of detach from their bodies and their emotional lives a bit, just because the strain is too much to stay in the present. And that's what happened in the past, and that can get repeated in the present.
Now, how important is sort of a sense of closure for trauma patients? And if they should lose a loved one to COVID or really anything else in the short term, they can't have
Mhm.
a funeral, they can't visit someone in the hospital. Is that going to make things so much worse for these patients?
Yeah. Um, I think closure in the sense of emotionally facing, coming to terms with, even articulating what's going on, it is important as a rule, I think, for everyone. And so definitely so for the trauma patients, and that yes, to lose loved ones and to not be able to see them and to say goodbye, if even at all, over Skype and telephone, it's horrible. It's really terrible. And I think part of the work will be, or part of what's coming will be the work with the psychological fallout of not just losing people, but also how we've lost people, or how people have lost loved ones, and the regret or the guilt or the just the depressive nature of not really getting a chance to say goodbye or mourn in the ways that we're used to mourning. I think that stuff is critical, and again, this disease is cutting us off from being able to fully do that, and it's extra challenging.
Now, do you expect a lot of nurses and doctors and medical staff on the front lines to kind of now face trauma issues in their own lives as they, in Manhattan see so and so many people die from this disease right in front of their face?
Yeah. Yeah, you're asking me if I
Yes.
see
Do
that?
you think it will like increase the trauma in a lot of our medical staff?
Yeah. Um, yeah, I mean, I don't see any way how it couldn't. I think that when any of us, when we're faced with a situation that feels out of control, we're seeing not just threats to our own life, but threats to the lives of others, and we're witnessing that. And there isn't that same sense of safety or containment in having enough PPE, in having enough medical equipment. That is the kind of stress that can potentially traumatize people. Not to say that people definitely will. Everyone's going to move through the situation with in different ways, but of course, doctors and nurses are people too, and they're facing a crisis situation, and and they'll need help as well.